Hello, Tim Kreis, Assistant Chief Operations Division and Management Co-Chair for the Deployment Committee.
Ben Lindquist, Ladder 22A Shift, and the co-chair of the Deployment Committee with Chief Kreis. The way that we want to start off this video and what was important to me as a representative of the membership out there is just to thank Chief Kreis. We've had a seat at every single table, operationally speaking, for this COVID stuff as we've gone through it. We've been able to represent the membership interests, both what we've gotten from you guys and what we think is important for our membership to make sure that it's represented at each meeting, and management has given us that opportunity to do that, operationally speaking, throughout this entire time. So thank you for that.
Thank you for saying that, Ben, and I'll say to you guys, that labor management relationship that we have and the feedback that comes up from you representing the troops out there has completely made everything that we've done organizationally through this deal work and be 100% better. So I can't thank you enough for representing and being a good partner for us.
All right, so just to highlight a couple operational things that we've put in place very early on in this process when COVID really started kind of to hit in late March, I think it was. Chief Kreis and I, we sat down with operations chiefs from around the valley. Brian Willingham was also there, and established a plan to be proactive about what might be coming our way. Truth be told, a lot of this stuff actually, a lot of our call volume actually went down in the very beginning. But what we wanted to have in place is if that surge occurred here, and potentially when it occurred here, as it seemed like it was going to be coming, that we had a plan in place, that we incrementally had triggers in place to be able to put resources out there to take care of our membership so that they weren't completely overwhelmed, to take care of our community so that we could still do the job that was expected of us. And we put that plan in place with the chiefs from around the valley. I think you should have seen that in your email. That plan has not changed. We had incremental steps at 15% increase in call volume, 20%, 25%. Of what would actually take place when that happened. But truth be told, while our calls did go up and while we did have a surge locally, we actually didn't have that increase of call volume compared to past years. So those things were never had to be put into place. Not to say that they wouldn't and that they still could not be put into place, but as of right now, we haven't had to do that. But that plan is in place and still intact should we need to implement that. The operations division is constantly changing. There's things that are going to continue to come out, even as I say this, and some of this information might be outdated. But check your email, stay up on the emails from PJ, and make sure that you're on top of those things. And the last thing that I want to talk about before Tim takes over here is the RBO process. It really does work. We've been trying to ramp this thing back up, and I know it looks different with everything going on. A lot of this stuff is online, but get your input to us. I'm at Station 22. I'm living this with you guys. I'm running the calls every day. I'm on a fire truck with you, and we've had a lot of great feedback, and we've been able to implement that stuff. There's no ego in this for myself or Chief Kreis. If you want something done, by all means, pick up the phone, give me a call, give somebody from the office a call, and let us know, what you're thinking. Because again, I'm out there living it with you guys. Everyone's doing a great job. I'm there to represent the membership at everything that I'm at, so there's nothing personal. Give me a call. If there's something that you think we should be doing different operationally, by all means, let us know, and we'll try to implement that the best we can.
Thank you, Ben. A couple things that I want to remind everybody of is that we have to wear the appropriate PPE for the work. So I'm seeing it on EMS calls all the time, and I want to thank everybody for doing it. But just as a reminder, the organizational expectation on EMS calls is, and really all customer encounters for the most part here, is that we're wearing an N95 mask, that we're wearing our gloves, and that we're wearing our goggles. And of course, when the situation warrants it, and you guys want to put on more PPE for a COVID call, you guys know how to make those decisions better than anybody. But just as a general sort of thing to point to protect our folks from exposure to COVID-19, the organizational expectation is the N95, the gloves, and the goggles for all customer encounters. Another thing that is really important to discuss and just remind everybody of, and I'm seeing this in the stations too, which just makes you so proud, and you see it when the trucks are driving down the road and folks are going to and from calls, is we got to be wearing our masks when social distancing is not possible. So So there's that piece there. The other thing I want to talk about is we put in place some things to limit our exposure in our fire stations, and that was done because of advice that we got from public health officials way early on in this process. And as a reminder, we shouldn't be doing station tours still at this point. We don't want any riders or ride-alongs, and otherwise station visits have been suspended. So the community centers are still not opened, and when those things start to open back up, we'll certainly let you know. I just want to remind everybody of that. From a customer service perspective, again, I want to thank everybody because we are seeing a reduction in customer complaints out there. And organizationally, you guys do such a great job on customer service, and we see way more letters from our customers thanking us for the excellent stuff that we do. We see tons of green sheets, and I just absolutely love reading them and following up with the folks who are involved and thanking them for it. But we do receive some customer service complaints, but I mean, I just cannot be more proud to report that the complaints are down this year, and I just thank you guys so much for what you're doing out there. Being nice to our customers and doing the right thing. We're just seeing it all the time, so thank you for that. And then lastly, thank you for your participation in the process. One of the most important things, and I have to thank my co-chair, Ben Lindquist, for this and his leadership in it. But the most powerful thing that we've seen in this challenging time, especially with COVID, is the participation, the passion, and the ideas and direction and concepts that are coming up through the process from the members. And you all have seen it, and you're going to see it in this video, is every single thing that we've come up with in this process organizationally has come up from somebody and some good idea that's made its way up into the process. And we just thank you guys so much for that.
Hello all, Ray Ochoa, Deputy Chief over EMS, alongside with Division Chief Ben Santillan. As you've heard, or as you're going to hear, all the sections within the fire department have been working very, very hard since the beginning of the year, since the onset of the COVID-19 pandemic. And what we want to do is we want to highlight some of the major areas in EMS that have been affected by COVID-19.
EMS, along with the other sections, have worked really close together to develop a comprehensive response model to COVID-19. You'll be receiving this packet in your training, and it highlights extensively what all the department has done for our membership. Our medical director, Garth Gamer, will be addressing alternate destination implementation, also refusals. Captain Joaquin Torres, our training program manager, will overview the CEs and core training and also our new treatment guidelines.
My name is Joaquin Torres, captain with the Phoenix Fire Department Training Program. Today I'm going to be talking about our CEs, our core training, and our new battalion training that we're going to be rolling out, some new ATGs. So our CEs, obviously a lot of our members have been asking about it. This has been an issue because none of the hospitals can get together due to the COVID guidelines. We still need to have CEs for our recertification. Right now we're working on a platform, an online Phoenix-only CE platform. A lot of our current platform is to go to Boundtree. You can still go to Boundtree University and have the free CEs. That's up to 19 hours of CEs. But we're creating content that's good content for our membership, good content that serves us as Phoenix Fire Department to have CEs on a private platform for Phoenix Fire Department. So you will see that roll out within the month. Right now I'm still creating some content for that, but you should see that within the new training that we're going to roll out as the ATGs roll out. As far as the core training's back. For a while there we had core training, and then due to the COVID guidelines we had to take the numbers and make smaller classes with in regards to the COVID guidelines. Then when the COVID guidelines or the COVID numbers peaked, we had to stop all that training due to the protection of the membership. We now recently got recently got the core training back. The only thing is we got to catch up. We have a lot of members that are, that we basically had an extension, and so those numbers that had an extension for DHS and for the American Heart, we need to get those members first. So there is a group of members that we're going to have to catch up. So the core training will be Mondays and Fridays. Just like the old training, it's going to be 8 to 5. The schedule and the agenda will be the same. So you will see an email from Melanie Perez that you will have core training coming up. So keep an eye on those emails. I know it's a lot of emails, but please keep an eye if you see core training from us, not DHS, to show what dates you're going to have those core training, the next core training for you.
Hi, this is Joel Navarro, Division Chief at Fire Resource. I'm going to go ahead and give you our PPE update. Right now we are doing very well in our PPE, from N95 masks, to gloves, to gowns. We have a decent supply coming in. Doesn't mean we're out of the woods yet, and we're trying to monitor how our supplies are being used and used appropriately, but we do have our supplies for our members to take care of our members out there. In addition to that, we have new P100 masks that are going out to each individual out there in the field for more security, and it's just another supplement for the N95 mask. With our commodities coming in, we are trying to plan hopefully up to 6 months to a 2-year supply of our PPE, so that when we hit another pandemic or any other issues related to PPE, we'll have a full complement of PPE for our fire personnel and PD personnel also. Our disinfectant commodities are arriving in daily, so we do have adequate supply on that. We have our Terminator 5-gallon jugs that are being refilled whenever they get low out there at the stations. The red shirts will take care of that. Our alcohol spray bottles are also out there at the stations. Once those get low, those bottles are refillable. Please place them back in the EMS locker, and then EMS, when they come out for the supplies, they'll take those empties and replace them with full alcohol bottles. So please replace and reuse those bottles. And that goes with the Terminator also. Try to reuse those spray bottles as much as possible. We also have hand sanitizer that's going out to the station, along with Lysol and some Clorox cleanup wipes we do have available. The PAWS wipes are also available out there for individual use on those too. So with that being said, we are doing fairly well with all our protections. We're trying to make sure that our resources are stocked appropriately. We're making some good gains on that. I know early on it was very hard for everyone to get PPE, but I think we're making or coming around the curve, so to speak, and we're going to be on our way. But with that being said, please use your equipment appropriately, and let's try to reuse what we can reuse when available. Thank you.
No, a little bit.
I got to move back. I got to move back a little
Just
bit.
a little bit, right there. You're good.
We need exactly 6 feet.
There you go.
Okay.
We're good. Hi, I'm Mike Ong. I'm the Deputy Chief of the Health Center.
I'm Noah Katz, Local 493 representative for the Health Center.
And we've been asked to brief you and educate you on some of the things that we have in place at the Health Center for our membership.
Local 493 and the administrative section of the Health Center has been working diligently to provide as many resources as possible for the membership and make sure that the membership is well taken care of, both on duty and if you do possibly contract COVID-19.
So I'm going to operate off an agenda that I have. They're bullet points, but we'll cover them briefly and hopefully explain the different resources that we have for you, starting with our testing. So COVID testing has gotten a lot better for our membership specifically. We have 2 places that our members can get tested, and it kind of depends, or does depend, on if you are symptomatic and or asymptomatic. If you are experiencing symptoms and want to go get tested, Banner is the appropriate facility to go through. It does require you setting up an appointment through their phone number. They give you an appointment, and then you go do a drive-through testing, which is at the state fairgrounds. That number, and we'll post it up on the screen, if you are symptomatic, then that phone number is 1-844-549-1855. And it's been my experience from the members that we've been caring for, that if you tell them, and this is the key, you tell them that you're a Phoenix firefighter, they get you in that day, and the results are pretty quick, typically 24 to 48 hours. And Noah, you can probably attest to that.
I can attest to it on a personal note. I got tested there. I had my results back in less than 24 hours by setting up an online portal, which they'll give you all the information to do. It's extremely easy to set your appointment, to drive down there. You drive right through the bay there. They swab you, and then you're out and you have your results in like Chief Ong said, about 24 hours. So it's a very easy process and highly recommended.
Banner's really taking care of us. So the second testing option that we have is if you're asymptomatic, have no symptoms. Your family, your household can also participate in this testing. And this is sponsored through the City of Phoenix, but the testing is run through Concentra. And that phone number, you still need to make an appointment through a phone call. That phone number is 602-534-0693. Again, asymptomatic for you and your household. And that, I believe, is a little bit longer to get your results back, but still between the 3 to 5 day mark. So there's really no excuse if you want to get tested, whether you're asymptomatic or symptomatic, that you can't get in. So that's our testing profile.
Yep, and from what the feedback we received from the membership, not only has both of those facilities done a great job with the testing for our members, but also for their family members, and their family members have also been able to receive results in a fast and efficient manner as well.
So let's talk about after the testing. What happens after that? We don't need to know about it if you're going to get testing. We would like to hear if you're experiencing testing or experiencing symptoms and going to get tested. That gives us a heads up, that gives your chain of command up. So if you are experiencing COVID-like symptoms, which includes fever, cough, body aches, lethargy, obviously if you feel sick, don't come to work, notify your chain of command, but also notify Scott Durkee. And what that lets us know is that we've got a possible positive COVID person being tested. Again, we don't need to know that you're getting tested, but what we do need to know is if you test positive. So if you go get tested, you're symptomatic or even asymptomatic, you go get tested, your results come back positive, you are required to notify your chain of command and Scott Durkee. Scott Durkee is our exposure control officer. His phone number is 602-702-4637. What that does is that initiates the process of us not only accounting for your time off, but making sure that you're doing okay. The health center gets involved, we monitor you, we notify HR, fire department HR, and then they take care of your telestaff for a number of days. Again, Noah can speak firsthand to that.
Yes, I can. It's an extremely easy process, as Chief Ong said. But following that chain of command is extremely important in that process. I would also like to add to that if you happen to be at work, we know that we have an obligation to the citizens of Phoenix to fill our trucks and to put them into service. But if you are at work and you do start to experience symptoms at work, please don't be afraid to go through that chain of command, notify your captain or your battalion chief so that they can initiate that process and get those hours covered so that you're not spreading any infection to anybody else that might be at your station at that time.
So we'll continue to monitor you as you are positive for this. And what I've seen through all of our membership, both sworn and civilian, is that the majority of our members are minor to moderate self-care symptoms at home. We have had some people that have had more severe symptoms, and we continue to monitor them, care for them, and provide them all the resources that the health center can. But the majority of people are minor to moderate with self-care at home, and usually by the 5 shifts that the fire department HR allots for COVID-19 positives, they're good to come back to work. Which brings me to my next point, is that there is a return to work process. And that return to work process is based on guidelines from the CDC and the county health department, which for us, we kind of morphed into the Phoenix Fire Department return to work process, which is a certain number of days being asymptomatic without the use of any fever or pain relieving drugs. You need to meet that return to work timeline. You also need to be on the mend, so to speak. So no one has a crystal ball. A lot of people come out of this with zero symptoms. Some people have some lingering cough, like asthma type deal. So what that entails is our clinician reaching out to you before that return to work date that you have after fire department HR has allotted your time off, and they'll do a phone return to work consult for you. They'll ask you questions like, when were your symptoms, when did your symptoms first appear? How long has it been since your symptoms have been present? Have you taken any medication? Do you feel better? And although most of our guys, the symptoms, like I said, dissolve, there seems to be some lethargy after the fact. And again, that's a part of the return to work process. If you don't feel like you're 100%, then you need to let us know, and our clinicians will make the appropriate notifications for your return to work. So.
Yeah, and with the return to work, one thing that we want to stress is that we created a program for the return to work to get our members back and healthy and in peak condition to be able to work smart and safely on a fire truck, and that's the COVID-19 COVID Fit program. And what that does is it allows our membership to be able to contact our peer fitness training staff and have a personalized program developed for them, which will allow them to have a consultation. They'll ask questions about your fitness level before you got sick, your current fitness level, symptoms that you may be feeling, any fitness equipment that you may have at your house, and they can kind of design a program around all of those things to make sure that you're getting back and healthy, and you're going to be a productive, safe member functioning on a fire truck when you are able to return to work. So if you would like to take advantage of that program, you can contact the health center, any peer fitness trainer or member services, and we will get you the right and appropriate resources for that.
And that's a really good resource because, like I said, there is some lingering lethargy from some of our guys that have been through this. So just another resource we're trying to think outside the box and provide for our memberships. I've been asked about the two things, the long-term effects of being COVID positive and then recovering. I don't think anyone in the world knows that right now. I think that is a worldwide problem, that we don't know what kind of lingering effects might happen. NOAA is doing perfectly fine, and we hope that stays that way, but we just don't know. The top medical experts just don't know. With that, we are really highly recommending that those members that do get a positive diagnosis for COVID start down the process of industrial reporting. Now, for those of you that have never filed an industrial report, it kind of seems, especially if you don't have any lingering symptoms, don't need any extra time off, don't need any bills paid because you had to go to the ER or a doctor's office or get meds. There's nothing to report. I'm good to go. I'm back to work. But we don't know what the future holds. So we're highly recommending that at the very least, you fill out a, first and foremost, an exposure report. Just like any exposure, if it was TB, whatever the case is, fill out an exposure report. That's found on both the Health Center website, but also FireWire has a COVID-19 link. In that link, you'll see a Health Center website, and you'll see the exposure report. Fill it out. It requires a supervisor's signature, and then inter-office mail that to our exposure control officer. That's first and foremost. Secondly, you can fill out what we call a precautionary injury report. And that's like the most common reason people fill that out is if they tweak their knee, on a call, and they're not quite sure if it's going to turn into an injury or not, but they capture that something happened that day to their knee, date, location, information surrounding that incident. You can fill that out, and you have 365 days from the date of injury to file an industrial claim. That's important to know, because on day 360, let's say, that knee starts to flare up and you decide you want to file an industrial case, you can still do that, and that precautionary injury report kind of documented and allows you to capture the information to transfer over into the industrial packet. If you do decide you want to fill out an industrial packet, which you can, and you can even fill that out if you don't have any issues. So you don't have any lingering symptoms. You don't require any more time off. You don't have any bills that you need to pay out of pocket for a doctor's visit, an ER visit. You have nothing to claim. I know it sounds counterintuitive, but you can still file an industrial injury packet. And what happens is they open it up and they close it that same day. That documents that you have both been exposed because you filled out an exposure report, but you filled out a claim. So again, at that 360th day, you start developing pulmonary issues or whatever, and your pulmonologist says, well, that was attributed to your COVID-19 positive case 360 days ago. You've got it captured, and the claim is processed as an industrial. A lot of little details in there. I think the important thing to remember is the health center is here to help you, and we'll walk you through each one of those steps if you have questions. And you can just call the health center main line and talk to one of our gals and just ask them, I'd like to talk to someone regarding an industrial claim. And typically you're going to get Anna at the front desk, and she's going to say, here's your options. This is what you need to know. This is what you need to do. It's a one-stop shop for you guys.
That is right. Chief Ong is absolutely correct with that. As we know, we don't have any idea what the long-term effects are as far as lung capacity, aerobic fitness, or lung function. And those are all things that are extremely important to us as firefighters. I would like to, first of all, thank the Phoenix Fire Department administrative staff for working so closely with Local 493 to get these industrial claims done and approved so quickly, as well as city safety. And our political team is down at the legislative office every day going to battle for us and making sure that these COVID claims are done quickly and efficiently. If you have any questions that can't be answered, please feel free to reach out to any of your shift reps or to any of the directors of member benefits with Local 493, and they'd be happy to assist you with that process as well.
Another question that I'll address that I get is, if I get it once, am I immune to getting it again? Again, I don't think the world knows that. They've got the top doctors in the world that are at odds saying yes, no, maybe. So we don't know. There's no crystal ball. Luckily, we haven't had anyone that's tested positive, recovered, and then got it again. Hopefully we don't see that, but we just don't know. And I'm not afraid to tell you I don't know the answer to that question. But as we get more information, we'll be sure to feed it to you guys so that you can stay on top of the latest. The next thing I'd like to talk about is what we're doing for our members out in the field as far as decontamination. So most of you know that we have and we've stood up a decontamination process for our rigs, specifically for our rescues, but we can do, ladders, engines, whatever the case is. And at first it started as a response to your station. And we soon found that we were being overwhelmed. So what we did is we created a decon facility at Station 10, which our rescue personnel can actually drive through there after they make their call to their chain of command and through the alarm room and get their rescue deconned. The spray and method is still a standard, a universal standard that is appropriate, but we want to offer beyond that. We want to make sure that we are offering our members not just the standard, but something that's up and beyond, and that's what our decontamination process is. It's a product that has been vetted through many government agencies, to include the FBI and the Food and Drug Administration. It's hydrogen peroxide based, and we use an electrostatic sprayer. And what that means is that not only is it contacting the surfaces that are in sight, but that ESS actually envelops and gets into nooks and crannies to include your air conditioning system, which is an important part. So we actually ask that you keep the air conditioner running, and while we spray it, we're actually decontaminating the ventilation system, which is hugely important. What we want to offer to you guys is not only still the ability for you to drive up to Station 10 through the appropriate notification process, chain of command, the alarm room, but we also want to make available the ability to become mobile again. So if your rescue is in Ahwatukee or in Carefree or way out on the west side, and it's just not reasonable time-wise for you guys to drive to Station 10. We want to be able to mobilize to come to you again. We have the staffing and we have the resources to be able to stand that up again. So all we want from you guys is to be able to use the process, and we'll make it fit you out there in the field.
Yes, we are extremely fortunate during this COVID-19 crisis to have the resources that we have with the Phoenix Fire Department. A huge thanks to our management team and our labor staff for working together for getting these resources for us. But it's a great process, and we really urge you to take advantage of those opportunities.
And then as far as the facility decontamination, there's a lot of you out there that have been at a station in where we have come to decontaminate the station, and I'll talk a little bit about that. So upon notification, we will go back 4 days. Upon notification of a member that tested positive at a specific station, we will go back 4 days from that notification, and if that member was in that station within that 4 days, we will dispatch our decontamination team to go decontaminate the station. And that's the same way we do the rescues. We just use bigger sprayers, essentially. And there's been many of you that have actually been at a station that have done that. After 4 days, research has indicated that nothing lives beyond that, especially when it's hot and there's so much cleaning going on by you guys in the morning as part of your station cleaning, that it doesn't do any good to go beyond 4 days. So if it's in 4 days, we'll go out and decon your station or your facility. If you are a member that works in staff, we will go to your section within that 4 day window and decontaminate that. And again, we want to provide the best, the highest level of service, not only for our exterior customers, but for our internal customers as well. That kind of encompasses our decontamination model. That kind of encompasses what to do if you get COVID. Hopefully you won't, or if you're just testing. We also want to mention some member services things that are in place in partnership with the health center. So member services in the health center. The local has been hugely active and supportive in all of our members and their families of those affected by COVID-19. To include, if you need a facility to stay at, if you've tested positive, or if you think you're symptomatic, we can make that happen. The Member Services Building, what's known now as the old CTC, a lot of people know it, we can outfit that for you to stay there 24/7. And we have stood that up for some of our members. Our member services support team makes phone calls every week and sometimes multiple times a week to all of our positive members. Right now it's Bobby Priest who's doing a fantastic, I gotta give him a shout out. He's doing a fantastic job. He's the one calling all of our members that are off right now for COVID. He's asking them, what do you need? What can we do for you? How are you feeling? Anything you need from the health center. And he's reporting that all back to us and to the local, and just making sure that our guys aren't unaccounted for. There's also online support, and we even have the ability, if you want to stay in a hotel because you just don't want to, maybe either you're positive or you're symptomatic and don't want to take that back home, we even have the ability to house you in a hotel, and that's also covered through member service. So a lot of resources out there. I'm pretty proud of the tools we have in the toolbox right now. And hopefully we start to, and we have, I'll say this right now, we've started to kind of level off with our numbers that were coming in, as the state of Arizona, and I'm even seeing other states starting to level off. We're hoping that stays that way. If it doesn't, we've got the tools in the toolbox to be able to support our members and to account for everyone. So with that, that's all I have, Noah.
Thank you guys for your time in listening to us and hearing about all the resources that we have through the health center. Just like to urge everybody to please stay safe out there. We know that people that live a healthy and active lifestyle have less of a chance of first of all, contracting COVID-19, and secondly, getting over the disease process a little bit faster. So just something to keep in mind moving forward. And thank you for your due diligence out there, making sure that you're staying safe and that we're staying, following the COVID-19 protocols as best that we can.
Stay safe. If you have any questions regarding the stuff that I talked about, specific to me, you can call me. Also, the Health Center main line can answer a lot of questions for you. Stay safe.
Thank you.
All right, hello everyone. Marcus Still, Battalion 9 B Shift, along with Ray Mayon we're both here representing member services. Just wanted to give you a quick little soundbite of what we're dealing with today. 2020 has been a tough year with the COVID situation, but basically what we want our message to be for you guys is that just like everything before COVID came along, we will respond. We'll respond as quick as we can, and we're going to adapt and help you guys out with anything that we can help you out with. So inside all that, we've implemented a lot of ways that we can help you guys with lodging, so on and so forth, but I'm going to let Ray Mayon talk about that.
Sure. So obviously 2020 has been a challenge for member services, but one of the good things about the local side is we can adapt and overcome fairly quickly. We don't have to live in kind of a policy-driven world. We can adapt to the needs of the membership, and we do that on a fluid basis, and we do it daily basis. So some of the things that we have been doing was food deliveries, lodging. We made 3 business type deals with the Marriott organization, the Grand Canyon University, and Grand Canyon actually had 2 hotels that they lodged our members in for a really reasonable price if they were tested positive with symptoms or even without symptoms if they were afraid to go home until they got their results. We did food deliveries. Part of the challenge from member services is with the HIPAA violations, we didn't know everybody that was actually sick and at home. So what I did is what we tried to do is if we had heard it in general population, then I would make a phone call to them and see what their needs were and address them. Obviously, we have all types of resources. We can respond very well. Very quickly. Also, we had addition of Brandon Leone, who's a new trustee, but he's been assigned to member services. Charles, myself, Nacho. I've even incorporated the members on my truck on engine 930 on B shift, actually the whole station. Those guys stepped up for whatever needs we needed, whatever the membership needed. So, and we continue to do that. It's still a fluid situation. We can still adapt and overcome the challenges in the future. So we just wanted to do this video to get out to the membership to let them know that we're still here for them 24/7. You could call me anytime. You could call Brandon, you could call Marcus, you could call Charles, you could call Nacho. The peer team was another part of our resources that we use through member services. They've been reaching out to members to see what the needs were. So you can reach out to the membership or the peers through Firestrong. And if there's any questions and any type of resources that we've missed that you feel that we need, we can address those. I just need to know. So you could call me. My phone number is 602-571-1771. I'm on engine 930 on B shift. You could call me at the station, or you could call Marcus, Chief Steele. Anytime he's Battalion 9 on B. Any questions? We're available all the time.
My phone number is 623-297-5971. So let us know how we can help, and we will.
Yeah, labor and management have worked tremendously well together through this crisis. Obviously, it's a fluid situation. It changed every day. So through our relationships, through the labor management relationships, we were able to address pretty much all the needs that we saw immediately. So thank you for all the work you guys do out there. Stay safe. Let us know if you need anything.
Thank you.
Hi, I'm Joel Navarro, Division Chief at Facilities. I'm here to give you a quick update on what we've been doing to help tackle the COVID virus. Within facilities, we have been adding plexiglass barriers to help protect our members and the public when they come into certain locations within fire buildings. Those have been established and been taking place. In addition, we're making sure that we have plenty of surgical masks if ourselves or a member from the public was to come into a fire facility. We do ask that people from outside do wear masks. In addition to that, we've had signs placed on all of our fire facilities and stations to make sure that people are wearing a mask as they come into our buildings. We have that both in English and Spanish to make sure that information is out and that people are aware before they enter a building. With that, we're asking custodial cleaning also be taking a deeper look in making sure that various areas are cleaned more frequently and that we have good disinfectant within those establishments. So door light switches, handles, frequently touched areas are being addressed more frequently to help prevent the coronavirus. In addition, we also are trying to establish more hand sanitizers, some wall-mounted hand sanitizers or portable hand sanitizers wherever possible. And we're also making sure that we're using touchless towel dispensers and trying to add more of those within our facilities so that we are not touching or frequently touching areas which could transmit or pass on the coronavirus. So at facilities, we're really taking a proactive approach. We've been making sure that our members and the public is taken care of and want to make sure that we're doing our part to help prevent the coronavirus. Thank you.
Hey folks, I'm Ryan Gray. I'm Division Chief with the Phoenix Fire Department Regional Dispatch Center.
And I'm Dennis Martinez, a dispatcher and a trustee with AFSCME Local 2960.
I want to share with you a few things that we're doing in the alarm room to help with the COVID response. One of the things we're doing is facilitating the transaction of Decon 10. If you have a facility or an apparatus, a rescue specifically, that has been exposed, go through your chain of command, reach out to the alarm room, specifically through the supervisor line, which I want to read to you, is 262-7496. They will reach out to Decon 10, and then Decon 10 will facilitate that transaction for you to get you cleaned up.
Some other changes we've made are to our EMD. On calls with certain nature codes, we're asking if anybody in the home has a fever, cough, or trouble breathing. If so, we're asking if they've had any known contact with a COVID patient in the last 14 days. If so, we're asking them to put a mask on and get the patient outside the door if possible.
There's a couple more things we're doing. One is we're having you tag calls C19. This allows us to track the calls so that we have historical data for how many calls we've run and potentially be able to trace the calls back to you for exposure purposes. The way we do this is have you reach out to the alarm room before you go AOR. This enables us to directly input the incident as a C19 tag right into the call. The last thing that we're doing is we're inputting premise alerts. These premise alerts come to us in a variety of ways. They come from PD, they come from other agencies, and they come from you. This allows us to input an alert in the system so that before you go on a call, if it already has a health hazard, you'll be warned. So, thank you, Dennis. These are a couple of things that we're doing to help with the COVID response.
So I just want to take a few minutes and give everybody an update in regards to our staffing within the Phoenix Fire Department through the COVID pandemic. Overall, we have had tremendous response from our membership as far as maintaining our staffing levels. Our members are coming to work, our members are signing up for overtime, and they're keeping our trucks fully staffed as we need. So for that, thank you very much. The ERSO continues to monitor this pandemic situation with our staffing policies. As you've seen, we have implemented some temporary staffing policy changes to minimize the movement of our membership around the city. By all accounts, it is having a positive effect. We're seeing our trend in COVID positive cases on a level out or go down. So we continue to reevaluate those temporary policies every 2 weeks. We make adjustments. We've decided to begin to phase in to our normal procedures with a 2-week window. So we're slowly starting to revert back to some of our standard staffing policies to normalize our staffing at the ERSO. The ERSO does have contingency plans in place if we see an increase in members that are positive and off work, or if we see an increase in calls for service and we put additional units in service. We have contingency plans in place, ready to go to be able to staff accordingly. Again, our staffing levels have done very well through this pandemic. I applaud the members and I thank them again for their commitment and dedication to coming to work and doing the job we all signed up to do. Please continue to do so. And as always, if you have any questions, don't hesitate to contact us at the ERSO. Thank you.
Hi everybody, my name is Michael Molitor. I'm the Deputy Chief over Human Resource Section within the Fire Department.
And Tim West, VP of Human Resource and Personnel for Local 493.
So we're here today to talk to you guys about the Human Resource Section's role in COVID-19 with the Fire Department, with our members. Human Resource has been tasked with providing our members with close contact notifications, managing leave associated when we have a member that tests positive for COVID-19, and then just providing general updates that come from the City of Phoenix and City Safety Department. One of the first things and the things that's probably really important to our members is our close contact notification. And what close contact notification is when one of our members tests positive for COVID-19, we look at the people or the other members that were around that member, and it's our responsibility to figure that out through telestaff and through predetermined time frames that were set by City HR or City Safety to go back and notify those members. Now, some of you have probably received that notification. That notification comes in a couple different forms. One is it comes in the form of an email, and then secondly, it comes in the form of a text. I believe the really important thing to remember about these notifications is that the fire department didn't determine this process. This process was actually developed by City Safety and City HR. And you've also seen this process change a couple different times, since COVID started. And it's because, we have to constantly adapt to the changing environment and the things that change with COVID.
Yeah, absolutely. And along with that, the local working close with administration and the city, we've brought concerns to the table, and we're gonna just keep continuing and try to make it better, and put the members' minds at ease and trying to get those notifications out even smoother. So we're just gonna continue to try to make it better.
So the second responsibility that HR has as pertains to COVID is managing the leave associated when one of our members test positive for COVID. And that leave is mandated through the Family First Coronavirus Response Act. Now again, Fire HR follows the lead of City HR and City Safety. So this federally mandated leave was put together and sent down, and then the city determines how that leave is actually put to use. So again, if a member tests positive, we have a process in which we use that we put the member off on leave. All of that was mandated by the City of Phoenix, and we manage that for you.
And I'll kind of add to that as well. With our careers and our work hours, our work week isn't a typical 40 hours. So the standard Leave Act that grants 80 hours to individuals when they test positive, I think kind of shows the strength of the relationship we have with city, with administration, and the local to even go above and beyond that, because technically 2 weeks for us is more than 80 hours. So that's how we were able to get some more hours in the bank, up to 120, to get our members the right amount of time to recover and recoup and take care of their families and come back to work safely.
And I think one of the really important things I need to stress with this is that when you do test positive, if a member tests positive, and we put you on this leave associated with the Family First Corona Response Act, is that it doesn't charge a member's leave bank. Mm-hmm. It doesn't count against you. This is something that the city and the fire department has managed, and we are helping the membership out with.
Absolutely.
And then the last thing that HR is responsible for is to just provide general updates. So as things change, and we hear this all the time, that COVID is constantly evolving, and the information that's being brought down or sent down from COVID is constantly evolving. As that information is come down or sent down to us through the city, through the HR and city safety, it's HR's responsibility to get that information out. And one of the examples that I would give that really affects our members would be like a travel advisory. So early on when COVID first started, there were certain parts of the country that had higher incidences of COVID, and there were other countries that were considered hot spots, that if you traveled to those areas, when you came back, you would be required to quarantine before you could come back to work. So, things like that we get made aware of, or as the policy change, or as city, federal guidelines change, CDC guidelines change, and the city changes the way that we react to stuff, they bring that down to us, and then it's our responsibility to get that out to the membership and work through our partners and relationships with 493 to do that.
Absolutely. I think we can all say that COVID has been such obviously impacted the world, right? And it's a thing that is constantly changing as far as the rules and regulations, and especially the concerns that you guys have out there in the field. We constantly strive to work together and make things better and more transparent. And I think that that's what this is all about. If you need anything or need any questions answered on my part, I believe my information will be at the bottom here. Please feel free to reach out, and as always, we'll try to get you the answers to the questions that you have. So we're just going to continue to work closely together and try to make this situation as best we can. So.
And I would agree with Tim that, as you guys have questions, our information is up on the screen right now. Please feel free to reach out, and again, we'll do whatever we can to answer your questions and to, guide you through this process. So appreciate your time. Thank you very much.
Be safe out there.
Hello, everybody. My name is Keith Slattery. I'm the Acting Division Chief over Fire Technical Services. Thanks for having me. I just wanted to give a couple of updates on what we're doing to support you all in the field and to take precautions with COVID-19. A couple of things we're doing is, if you haven't seen yet, on FirePoint, we have a COVID-19 page that you can access. On that page, you'll find all the most recent memos, anything from operations, from Chief Cockbrenner to member services. That's a repository for all those members that you can go back and find those memos that you need. Another thing that we're doing is we're collecting data to help support operations and the exec staff making decisions out there in the field to help support you guys. Also, what we're doing is our service techs are spending a lot of time out at the fire stations making sure that your technical needs are met. So what they're doing is that they're wearing their masks, they're taking their precautions, keeping proper distances. They're wiping down those surface areas before and after to help protect you guys. And what I'm just asking is that when you're in that close proximity area with those folks, just please help them out. Wearing a mask yourself, that's going to help protect you and our service techs out in the field. Please, if you ever have any questions, don't hesitate to call me directly, or you can email the service desk or call that phone number that'll be shown up on your screen. I appreciate what you guys do out there. Stay safe, protect each other, and thank you very much.
Hi, this is Joey Fleet from Homeland Defense. We just wanted to clarify a couple things. So the Phoenix Fire Department will continue with the policy of no station ride-alongs or no station tours. We've suspended those activities until further notice. If citizens come to you and ask for those services, you can refer them to phoenix.gov website under the fire section, where it clearly explains our intentions of this suspending this policy. If you have any questions or any concerns regarding COVID or some security issues or situational awareness, please reach out to us at Homeland. You can reach out to myself, Jack Ballantyne, Gabe Sines, or any of our 958 TLOs on shift. On A shift, we have Josh Shagabarth. On B shift, we have John B. Dean. And on C shift, we have PJ Dean. All excellent resources to help you if you need some clarification or need to liaison with other public safety or PD. So thank you and be safe.